Honourable Philip J. Pierre championed the actions of Honourable Moses Jean-Baptiste during 2024's Vieux North Constituency Group Annual Meeting, affirming that the Minister for Health, Wellness and Elderly Affairs was dealt a hefty challenge following his entry into office. This sentiment rings true for the constituency of Vieux, as for too long medical services have been lacking ever since the St. Jude Hospital fire. According to the Prime Minister, healthcare in Saint Lucia to date is by no means invaluable, but it is not as bleak as the opposition would have society believe. Prime Minister Pierre went on to assert that the accomplishments of the Saint Lucia Labour Party in revamping the healthcare situation on the island should not be overlooked, but it has become the opposition leader's goal to undermine and downplay all progress made in Saint Lucia's medical landscape, spearheaded by Honourable Moses Jean-Baptiste.
Someone who would not use his ministry to push his own agenda or to use the power of the ministry, but someone who genuinely cared about the health of this country. Someone who genuinely cared about the well-being of the people of this country. And when I hear the criticisms that some people try to label the minister with, it really concerns me. Because the health in this country, regardless of the issues that we have, and I want to clearly state that we have issues. Every country in the world has issues with health. If you listen to what's happening in the UK now, you will find issues with health. Obamacare still has issues. Every health system in the world has issues.
In his statements, the Prime Minister affirmed that before the prior administration, handling of healthcare, primarily the introduction of the OKU hospital, was handled so poorly that the Health Minister and people of St. Lucia are still feeling its effects to this day.
The hospital was full. They hastily transitioned into the OKU hospital. So the hospital was never fully transitioned from Victoria Hospital to OKEU. And up to now, Musa is suffering from that bad or that poor transition. Up to now. So, then they went in because of COVID. When they came into government, there was a Delta variant of COVID. The Delta variant. The Delta variant was the worst strain of COVID ever. People were dying from the Delta variant. They predicted that under Labour and under Musa and under me, people would be dying on the hospital floor. People would be in boxes. People would be on the ground dying. Musa stood with the doctors and we worked and we kept back the dire consequences of what they were predicting for the Delta variant.
The Prime Minister stated that all hard work and effort shown by not only his administration but all workers within our medical industry post-COVID must not be downplayed, as we have made substantial progress.
We strategically did step by step. Step by step. We are advancing slowly but surely. But of course we have issues. And I want to put on record my appreciation to the nurses and doctors in Saint Lucia. My appreciation to them for the work that they do in the hospitals. The nurses, the doctors, all the medical people, we appreciate them. We appreciate them. But I tell you something. If anybody believes that they will use the health care in Saint Lucia to play politics, tell them to wheel and come back again.
At the 2024 Vieux North Constituency Group Annual Meeting, Prime Minister Honourable Philip J. Pierre commended Health Minister Honourable Moses Jean-Baptiste for tackling the significant challenges in St. Lucia's healthcare system. He countered the opposition's criticism, asserting that while healthcare is still a concern, the government's achievements should not be downplayed. For Choice News Now, this is Obi Offor.